Thank you, Zach. It's No Smoking Day, and Jane Dozier from St. Mary's Hospital has come in this morning with some very interesting statistics, as well as what smoking actually does to our body. Let's cover some of those statistics that you brought in this morning.
Absolutely. According to the Center for Disease Control, 1 out of 5 deaths in the United States every year is a direct relation to smoking. And that includes people that are impacted by secondhand smoke. Those numbers add up to over 430,000 deaths a year that are related to smoking diseases. Wow. It's preventable.
And it's terrifying.
It's terrifying and it's preventable. And unfortunately, it becomes important when someone gets that diagnosis. And then it's too late. There is no amount of smoking that is good or okay. Because what it does to the body is impacts all the tissues, every organ, in a negative manner. Smoking is the cause of lung cancer. It's the cause of bladder cancer, esophageal cancer. It is the cause of cancer of the throat. It is the cause of vascular disease, which leads to heart attacks, strokes, exactly. Bad breath, teeth, smell. There's nothing good about it at all. But it is an addiction. And that addiction is related to the fact that it is the ingredients in cigarettes are nicotine, cadmium, they're lead, they're related to batteries, methanol, which is rocket fuel.
There's
formaldehyde.
More than what the average person would. You don't think about everything that's in a cigarette.
No, you don't. There are over 600 ingredients in a cigarette, and when those ingredients are burned, they form over 4,000 chemicals, 50 of which are, at least 50, are known to be carcinogenic. The rest of them are simply toxic. When you think in terms of what is supposed to happen in the airway, we're supposed to take in oxygen. Our cells need oxygen. So the smoke itself, which is heated, is taking up the space that oxygen needs to be. And it is inhibiting the ability for the cells to exchange oxygen in for carbon dioxide out. What's going in, you've got an oxygen deprivation, first of all, because smoke is there. What's going in are all of those chemicals that you're breathing. Those exchanges in the body are taking place between the lungs and the vascular system. It's simply not what's supposed to be there.
It isn't, and a lot of people have so much trouble quitting, even if they want to quit, which is the first step, which is deciding to quit. And you also brought a list of online smoking cessation recommendations that you have for us. There's several.
We have the American Lung Association, the American Heart Association, the Missouri Department of Health and Senior Services has a website as well. It is a challenge to quit smoking because it is an addiction. So individuals need to be able to get the medical and the behavioral support and assistance to stop smoking, to be successful. Your body craves the nicotine.
And that's also what you're here for. We'll have information about contacting Jane and her advice today on connectmidmissouri.com. Back to you guys.
Okay, thanks, Carissa.